Managing pain in our aging population. When discussing pain in older adults, it is important to distinguish between acute and chronic pain. Acute pain is short-term discomfort that typically lasts days to weeks and is often caused by surgery, injury, or medical procedures and resolves as the underlying issue heals. Chronic pain or persistent pain affects 55% of the Canadian population, particularly older adults and women. This long-lasting discomfort persists for 3 months or more and often develops after an episode of acute pain. It can vary in intensity and commonly associated with conditions like arthritis, nerve damage, or other long-term health issues.
It is important to understand and address the emotional and psychological impacts of older adults living with chronic pain. Many patients experience frustration because they don't know how they will feel from day to day. As their pain is unpredictable and relentless, this can lead to secondary issues such as loss, farther decreasing the ability to cope with physical pain. Sleep disturbances, social isolation. Nurses can overlook or superficially assess these psychosocial aspects, resulting in gaps in care planning and management of the pain. The stigma surrounding chronic pain is a significant challenge for older adults. The reliance on pain medications, often necessary for basic daily functioning, is frequently misunderstood. The opioid epidemic has exacerbated these issues, fostering societal judgment towards patients using these medications and making some healthcare providers hesitant to prescribe them. Consequently, older adults may underreport their pain, citing factors such as medication costs, fear of addiction, stigma, or the belief that pain is an inevitable part of aging. Effective pain management combines the use of non-pharmacological and pharmacological approaches to help manage pain and tailor it to the patient's goals or needs. Beyond medication, reducing suffering calls for active listening, unconditional positive regard, ongoing support, and resource mobilization. Nurses have a long history of supporting patients with the use of non-pharmacological measures. For example, relaxation techniques, forming a caring and supportive relationship to aid in pain management.
Environmental adjustments to reduce pain and enhance comfort. Based on Stockard, sleep and rest are essential for pain management as many older adults with chronic conditions struggle with it. So what nurses do is we adjust the room temperature, limit the surrounding noise, and dim the lights, which could ease the pain that they're experiencing and promote rest. But it is more important to follow the elder's preference. We would also make sure that the environment is free of hazards, especially on the floor, to avoid any fall risk which could cause an additional pain. And according to Stark Weather, elders are at higher risk for falls. Advocating for multidisciplinary care, according to Starkweather, pharmacists, physicians, physiotherapists, nurses, and other healthcare members work together with an elder to discover an effective, holistic pain relief measure that fits the elder's choice. Linking pain management techniques to other aspects of health and wellness. As per Starkweather, some methods of pain management such as acupuncture, guided imagery, massage, music, or exercise can help divert an individual's attention from their pain and could improve their overall mental, physical, emotional, and spiritual health.
The goals of pain management are to promote comfort and maintain the highest level of functioning and well-being as possible. Most older adults prefer to remain in their homes, aging in place, rather than relocating. However, older adults living with persistent pain may need to consider another housing option due to the severity of their pain and capabilities, and this can be a tough transition for many older adults. There are community services available to support aging in place, such as Adult Day Services, which is a community group program designed to provide social and health services to older adults who need supervised care in a safe setting during the day. There is also a home and community care that provide health services at a home rather than a hospital or long-term care home. There is also supportive living for older adults who need a little more care than can be offered with independent living options, such as supportive housing and retirement homes. If chronic pain becomes unmanageable for the patient, they may need to move to long-term care home, where they are provided around-the-clock care. This, however, is a last resort after all the care options have been exhausted.
Management of pain, both acute and chronic, in older adults is extremely important, as the consequences can be detrimental. Some of these consequences can include depression, inability to move around, and muscle deterioration. It is important to find therapeutic treatments that will reduce pain and therefore increase quality of life. Reducing or eliminating pain in individuals has multiple positive effects for older adults. Firstly, it can help a person have more energy, improve sensory functions, and allow for better sleep. Psychologically, it can improve positive feelings, cognition, self-esteem, and body image and appearance. Pain management can also improve mobility and ability to participate in activities of daily living, as well as an individual's social relationships. A person with less or no pain is more likely to participate in recreational activities they enjoy. Overall pain management improves every facet of a person's life. The medical community must stress the importance of open communication about pain. If healthcare providers are aware of pain in their patients, they can work to find therapeutic treatments that will reduce or eliminate pain. It is also important that we, as healthcare providers, take complaints of pain seriously. It's important to be honest with healthcare providers about how much an individual is experiencing pain so it does not get worse over time, when treatment will be even more difficult.
As practical nurses, it is important that nurses adhere to the patient's pain and comfort management. This is a crucial part as this provides a holistic, patient-centered care that improves the rate of recovery, comfort levels, and the overall quality of life. For example, Kevin has recently felt discomfort and had trouble with balance while trying to walk with no assistance. I advise him to use a mobility aid such as a walker, and he tells me that he isn't quite sure how to properly use one. Now, it is my duty as a nurse, according to the CCPNR, the Canadian Council for Practical Nurse Regulators, that I am, quote unquote, an active participant in health promotion, illness prevention, and harm reduction activities. This is where I informed Kevin of the proper instructions with evidence-based practice and a guide on how to use a walker. By guiding Kevin the proper and safe way to use a walker, I've reduced the chances of falls, accidents, and serious injuries while improving his personal autonomy and his overall quality of life. The decisions we make as nurses all correlate to our standards of practice within the CCPNR. Without these guidelines, nurses wouldn't be able to give the safe, holistic care approaches that they do now.
In summary, effective pain management is key to maintaining the health, independence, and well-being of older adults. By following CCPNR guidelines and providing patient-centered care, we can ensure they receive the support they need. Let's prioritize comfort, dignity, and quality of life because every older adult deserves to live pain-free.